Hello everyone, I'm Dr. Asma. I am an international medical graduate. Welcome back to my channel. And I've been requested to make a video about how to present the audit findings. So I hope this is really helpful and it's very easy to use. It uses a very standardized format and I will talk you through. So let's get started. The first slide I will tell you what is the outline, what's the standard practice of presenting an audit. So first slide should be about title. It should be followed by background, aims and objectives, standards, methodology that you have used, then your key findings, importantly your recommendations and action plan. The first slide that I have shown is your heading. It's the main first slide of your presentation. So you need to write the name of the audit and participants with their role. Then it comes to the second slide, which is about where it was taken and who were involved. So your department, whether it was local department or XYZ, project lead, name and designation, along with participants, how many they were, along with their name and their role. Now we move to the important slide, which talks about the background of the audit. So whatever clinical problem you're investigating, you should have a concrete knowledge of why it is important. So it's very easy that you can go to the standard guidelines like NHS guideline or your trust guidelines and use the first few paragraphs and choose a few sentences about importance of that clinical problem. For example, here I have used asthma BTS guideline, which tells about how important asthma is, how many patients are having asthma in the UK and how many patients are actively using the medication. And then you can also add it that in your practice or department, asthma is the main cause of daily or frequent admissions or H2 admissions. So just to stress that how why it gives you the evidence of why you have chosen this specific problem. Moving on to your aims. So I have kept it very general and I think this works best for most of the audits. So either you're mostly comparing your practice with the standards. So the result is you're improving, you want to find the gaps and you want to improve your practice, you want to improve your understanding and you want to educate the staff about the current guidelines, you want to improve patient confidence, patient experience, you want to improve their follow-ups, you want to plug them in the right clinics. So I think most of you can use as a generic template. Moving to the objectives, now it's kind of a cheat sheet, I must say, that each of this standard you can use and do individual audit on. So don't populate it with all these things. You have to choose what you're looking for, right? So whatever is your area of interest, choose one or two things and then you start your Excel sheet and data collection. So for example, I have taken this from the BTS guidelines to determine if appropriate patients are being assessed by the nurses. So what you have to do is you have to go back to the patient records and see if they were triaged by the nurses and appropriately what were the parameters assessed in regards to asthma. Then you can also go if full history was taken and alternative diagnoses have been ruled out. So there are a list of things which should be ruled out if you're considering asthma, like COPD, heart failure, XYZ. Then you see if pulmonary rehab was offered to the patients with functionally disabled by their COPD. Easy, you can see if the referral has been sent, depending on their records, as well as smoking, and then it comes to the self-management and advice plan. So I think this is quite useful to visit the problem you're interested in. Go to NICE guideline or your departmental guidelines to choose 2 or 3 topics or 2 or 3 parameters that you want to identify and then take them further. Now coming for threshold for compliance, I think it is more or less acceptable in most of the NHS trusts that your full compliance is more than 90%. If you're compliant with any standard more than 90%, you're quite good to go. If you're partially compliant, this means between 89 to 70% is the compliance rate, and if it is less than 69, it is worrying. So you have to outline which area you're considering and what are your expectations, where the where should you fall. Now we come to the audit standards. You should clearly write the name of what standards you're using. So this is NICE guideline NG80. So they are the asthma BTS guideline. I have written a few things. You can choose one or two. Either you are collecting data for inhaler technique, asthma control, self-management plan, use of preventers, follow-up, and the list goes on. Sampling is very important, so you have to be very sure of what people you're sampling, whether they are their age limits, their other comorbidities, and their diagnosis or their diagnostic workup. So you have to clearly write what patient cohort you are studying. Finally, it comes to asthma findings. So whatever, depending on what factors you have made your Excel sheets, collected the data, you have to present it in terms of percentages and numbers. The same things you can then convert into pie graph chart and bar graph charts, and the list goes like I have just written. You will have gender at least and age, and then if you were thinking, if you were analyzing personal asthma plan, then how many were compliant, how many were not, and the percentages. Now the important slide of observation. So I think this is also a good practice to write your observation, which has the following parts, like overall, what have you gained from the study. So I would say it was a good practice to understand the gaps or to understand our practice. So what important problems you have highlighted. The areas of good practice should always be considered, because sometimes we want to overlook in search of finding our audit or giving it more importance and findings. We try to override or probably ignore the good areas of good clinical practice. So keep in mind and do talk about areas of good practice. Then you need to come to the final point, which are the areas which are identified as gap and they require improvement. Now I would summarize my audit as that it has identified the gaps which we thought were incomplete adherence to this, and substantial number of patients were not assessed or were not plugged in the right directions. So you can manipulate according to what you have found in your results. Importantly, most importantly, you have to come up with recommendations. They shouldn't be a rocket science. It should be directly straightforward that you have identified this gap, and next time whenever you're assessing the patients, if these forms are not properly filled or assessed or done timely, then you need to improve on them. So in order to do that, what steps you want to take? You want to encourage staff to engage in asthma planning, to have some departmental teaching, to make some new performer or make some changes in the existing performer. So all these little changes can immensely help in future when you re-audit. And of course, after implementing these things, you want to re-audit. Final is an action plan. I think the whole value of your audit relies on action plan and recommendations. So if we have spoken about recommendation, now the action plan. So action plan is actually objectified measure of what is done so far, what are you proposed, and what's the timeline of all these interventions that you have highlighted. So you talk about the recommendation and then what action that you have opted to do. For example, if you have opted to educate your staff or create a leaflet or create some additional paperwork, so you need to write exactly what you have prepared or proposed, and whether it has been discussed by your departmental lead, what are the timelines, what time it was proposed and what time it will be implemented, and what is the current status. So I've given a nice table to show different aspects of action plan. So that was all. I would say that most of the trust they would adhere more or less to the same skeleton and structure, and it's a good idea to get well versed with it. Choose your areas of interest and start working on your project, and I hope it's really useful. Thank you very much, and bye.